Welcome back to another edition of our Sunday sit-down Q&A. Thank you so much for your questions. We're really excited about what we're going to talk about today, being pumping and breast pump parts.
Yes.
We're going to talk about baby spit up and why it happens and maybe some things you can do about it. And then also how things are going with our current pregnancy ourselves.
Yes, so if this is your first time meeting us, I'm Sarah. I'm a board-certified OBGYN.
I'm Kurt. I'm a board-certified pediatrician.
And we are the Doctors Bjorkman. All right, let's get into it. Our first question this week comes from Jade Perry, and her question says, pumping hygiene and safety. I've read different advice on cleaning pump parts. Clean versus sterilize versus sanitize. Pump companies say only boil or sterilize the parts before initial use, then just clean. Others, doctors and parents, say sanitize and sterilize once daily or even after every use. And the CDC says once daily if under 3 months old, but doesn't say that age. Does that mean not all or once a week? You know, what's needed? I don't mind boiling parts as often as needed if it protects baby, but then I read that boiling parts will cause plastics or chemicals to leach into the milk. Feels like a catch-22. Boil to kill dangerous germs, but get harmful chemicals, or not sterilize and wash in only hot water and dish soap and risk baby getting sick. I have stopped pumping because of it, so now I'm going to get my supply back.
There's a lot there. And
Yes.
Totally understandable.
Totally
right?
understand, because
There's so much information. What do you do?
What do you do? And you've never done it before. And I've been there. I remember when I got all my pump parts and a bunch of pacifiers and all this stuff, I boiled it all in a big pot. Some of my more experienced mom friends laughed at me and said, what are you doing? And I said, that's what it says to do. So in terms of recommendations for breast pump parts and feeding your baby, the factory recommendation again is to sterilize and boil those parts once for 5 minutes. After that, you do not need to do it again, and cleaning with warm soapy water is very, very safe and an effective way to clean those parts. There is some thought, pediatrician can weigh in, that if you have a premature baby that is immunocompromised or has other risk factors for infection, then maybe you want to consider some of these more intense sterilization procedures, because you want to be so careful with their fragile immune systems. But for normal, healthy term babies, you can just wash those pump parts in warm soapy water or the dishwasher or whatever works for you.
Yeah, I think it's good too with that point, just in terms of washing. This is the thing, you've used them and then you wash them right away. Or if you can't wash them right away, keep them in a Ziploc bag in the refrigerator too.
The fridge
so then
method,
that milk isn't getting dried on. So then it also keeps bacterial growth down on that fluid and on those parts, and then keeps that moist for when you go to wash them, so you don't have dried on stuff on it, right?
So this is called the fridge hack. We actually have a whole playlist of videos about breastfeeding and pumping. And in that, I talk about the fridge hack, talk about breast milk storage guidelines, some of these cleaning things. So we'll link that whole playlist here for you to check out. But the fridge hack saves so much time. Pumping sucks. And and then having to clean your parts every time after you use them, nobody has time for that. And so the way around that, is you pump, you put your parts in a Ziploc bag, and you put it in the fridge when you put your milk in the fridge. And then, as Kurt was saying, the next time you go to pump, you take your bag out of the fridge, you put on your pump, nips are a little cold, but things, again, are fine, and it is fine to do this throughout the course of a day. And then again, wash those parts once at night. So hopefully that saves you some time and can save, your breastfeeding and pumping relationship. Pumping is hard enough as it is. And so some of these hacks really help in terms of safety for your baby. Washing parts once a day with warm soap and water is very safe, again, for healthy term babies.
Our next question for this week is going to come from Amanda Brown. She asks, why do babies spit up? I know that part of it can be due to an immature digestive system, but how about when it varies? Also, is it related to eating cheese while breastfeeding? So there's actually a decent amount to unpack there. So the first thing of why all babies spit up is exactly what you alluded to, in that they're immature digestive systems. What it is we all have a muscle, a sphincter muscle, on top of our stomach. So we swallow, food goes down our esophagus, which is the feeding tube that connects our mouth to our stomach. And right at the bottom of that, on top of the stomach, is our esophageal sphincter, which is a special muscle that is squeezed closed all the time and then relaxes to let food into the stomach when you swallow, and then closes back down again. In babies, that muscle is actually pretty thin and pretty short, which just means that it's leaky and more prone to spit up, especially with position and things like that.
So leaky. Yeah.
As they grow and develop, that muscle becomes thicker and elongates as well, which just means it's better at holding the food into the stomach once it gets in there. And so this is why all babies are gonna spit up, but almost all of them grow out of it by 6 months, or sometimes as late as 12 months of age, which just means you're gonna go through a lot of dirty bibs and clothes and wipes. The question that you then have is like, when is spit up abnormal? And so the things that there can happen in severe cases, you can have so much spit up that there's actually, you're losing calories from it and they aren't growing, or that acid can start to erode at the esophagus. Now, if you have a baby who spit up a ton, like ours did too, you're wondering, is this too much? Like, how do I know if this is too much? And again, your pediatrician is going to be able to check these at those regular well child checks every 2 months or so. And if you're concerned in between, then you can call them. But if they're growing along their growth curve, they're getting enough calories, even if it seems like they're spitting up all their food, it's amazing how much stays down. And then in terms of like, is there damage to the esophagus? As long as it doesn't seem like they're in a lot of pain with it, there probably isn't. In some cases, you'll think about adding an antacid if there's really a lot of pain with it. And again, that's something you should talk to your pediatrician.
Right. I feel like, I mean, gosh, we went through so many spit rags, and I remember I was just like, is this a normal amount of spit up? Is this, I don't know, she's the first baby I've had, and Kurt said it is. It's often baby spitting up is just a laundry problem. And
we had lots of laundry.
We did.
Yeah.
We did.
The other thing you asked about cheese while breastfeeding. So there are times where babies can have a milk protein allergy that they often grow out of if it happens in the first year of life. But in those babies, mom's dairy consumption while breastfeeding can actually play into that. That usually shows up not necessarily as spit up, but lots of kind of GI distress, sometimes poor weight gain again, sometimes it's spit up, sometimes it's lots of diarrhea. And that's something that like you should talk to your pediatrician about. Like, do you need to eliminate dairy from your diet? I wouldn't do that based solely on just lots of spit up and lots of dirty laundry. I would think more about there's growth problems, lots of spit up, diarrhea, my baby's in pain. Do they have a milk protein allergy that could show up if the baby's formula fed or if breastfed and mom is consuming dairy? A challenge there too is about half of those babies that have that allergy to milk protein in the first year of life can also have that same allergy to soy, and so then there's special formulas if you have a formula fed baby that need to be thought about in those instances.
all right, our final question comes from Marianne Hayes. She said, just wondering how you're doing and feeling this pregnancy compared to your first. What are you excited for with having a baby boy?
I feel very much the same.
Yeah, I want to be the dad in the next pregnancy is what I want. It's different and the same in many ways. I'm going to do a whole first trimester vlog, like 2.0. I would say the first trimester fatigue crushed me this time. I was so tired. I was also trying to study for my board exam, so that maybe didn't help. Other things, I just don't, with the first pregnancy, how far along with you? Oh, I'm 6 weeks and 3 days. Oh, I'm 7 weeks and 1 day. This time they're like, oh, how far along are you? I'm like, I don't know. Are we 8 weeks, 10 weeks? Where are we at?
I think having like a small bear cub of a toddler running around, just like there's enough craziness that it's amazing how easy it is to miss out on some of those fun little details from the first pregnancy.
Yes, a lot of details just get let go because they're just, it's not important. You don't necessarily have time for that. Like last pregnancy, you know, we did a picture every week and
we made an
documented
episode
it.
every week that we like walked through the medical evidence of, and it was so much fun.
I don't know that I've taken 2 bump pictures this time. So it's just, there is this like second pregnancy phenomenon, and I think things aren't new. You sort of know what to expect, which is nice. And also then you're generally busy chasing around a toddler. And so at the end of the day, you're just like, okay, we're gonna fall asleep at 7 o'clock on the couch now.
I think the one thing that you've done differently this time than the first time, that even was a priority in the first time, but have more emphasis on this time, is just staying physically active too.
For sure.
You know, we talked about the importance of exercise in pregnancy during the first one, but
I'm a human and am not perfect, and often it was a choice between napping or exercising or doing other things, and I did not exercise as much as is recommended or that I wanted to, and I really was sore, like had physical, I had like SI joint pain in the second trimester, I had pretty bad SPD or symphysis pubis dysfunction around like 32 weeks. And I said, I really want to make sure I continue exercising and strength training to try to help with some of those things this pregnancy. Because when that kicked in, especially that SPD at the end of the 3rd trimester last time, I really started doing gentle strength training exercises to try to help with, you know, core strength and some different things. And I really felt that helped me with that SPD. And so I said, I gotta keep moving and exercising this time, or maybe I'm gonna break. And I don't wanna do that. So far so good. It's early, but am exercising more. And it's hard. It is so hard. Like, it's so hard.
life is busy.
Life is busy and exhausting. And so I know how hard it is to get that recommended 150 minutes of exercise per week. I definitely am not doing it, but I'm doing better than I was last time. So that's a goal. Yeah. Boy, I don't know what to do with a boy.
I think you're gonna do great.
Well, I hope so. Yeah. There's a no return policy, so we'll be keeping him.
We'll keep you updated as we go.
Yes.
Thank you so much for joining us. Please make sure you're subscribed. We've got some episodes coming out on Wednesdays, of course, and more questions next Sunday from you all.
Have a great week.
Bye, guys. We're doctors.
But not your doctors.
Anything we've said in this video is for education or entertainment purposes only.
It is not medical advice.
Any specific medical questions you have should be directed to your provider.